an important discovery. That's how health officials are describing their longed-for break in identifying what has killed more than 60 Cambodian children. CNN's Sarah Seidner is joining us now on the line from Cambodia's capital, Phnom Penh. So, Sarah, you visited the hospital there, the province where most of the children fell sick. Tell us about what the discovery was of what is causing their sickness.
Well, the World Health Organization and public health officials here want to be very clear. They have not discovered what is causing this particular mystery syndrome, is what they're calling it. However, they have found that there were more than a dozen of the cases that they have tested did have what is known as EV71. It's an enterovirus. Basically, it's one that's associated with hand, foot, and mouth disease. They've discovered in samples that existed in some of these cases, but they want to be very clear that that does not solve the problem of these undiagnosed cases. It's just another clue towards perhaps solving it and finding out exactly what this is. They don't know if they're dealing with some kind of new illness or if this is an illness that is perhaps a number of illnesses together that has turned out to be quite deadly. And as you mentioned, most of the children who end up in the hospital with this mystery syndrome end up dying, Ralitza.
So, Sarah, now that they have identified one possible cause, is it possible for them to be more effective in treating those children?
Well, this is the difficulty. There is no known treatment or cure for EV71, this virus. They are still working on a treatment, the scientific community. And so you have the difficulty of that and the difficulty in not knowing exactly what else might be making this such a virulent strain of whatever this disease is. Doctors very concerned, trying to get the information out to the public here, which is a bit of a difficulty. We spoke with some patients in a hospital where there were 2 cases in the southern part of the country, and that doctor said, look, one of the children, actually, he saw the child's lungs deteriorate rapidly. Literally from hour to hour, this child's right lung just deteriorated and the child died. Another child that came in with these symptoms of vomiting, very high fever, and difficulty breathing, that child died within 48 hours. Both children perished actually within 48 hours. So this is one of those things that they're trying to get the information out to people, that if your child has some of these symptoms, a high fever, that they are vomiting quite a bit, that they have difficulty breathing, especially, to bring that child to the hospital. Do not treat the child with medicines on your own. Do not just take them to a local clinic, but that child needs to immediately be brought to the hospital. A lot of concern here as to what they're dealing with, and they have not figured out exactly what it is, Ralitza.